Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our open clinic on YouTube. Today is a very special and also interesting topic. So we're going to look at alcohol. We're going to look at the effects of alcohol on general health, especially men's health. But we're also going to look at the women's aspect of consumption of alcohol. How can this affect your general health and your reproductive health? So it's a very important topic because right now, as I'm talking to you, majority of adults are using alcohol, and some people are using excessive alcohol, and some people are mixing up a lot of rumors, a lot of hypotheses about alcohol. My aim is to help you to understand it better. There are some specific people that should not take alcohol completely. So I'm going to try my best to help you to understand it better. So once you come in, announce your name, announce your location. I'm going to spend the first few minutes to talk about my presentation. Then afterwards, I'm going to take care of your questions. So please make yourself comfortable. Make sure you announce your name and location before I start. Okay? So remember, we're talking about the effects of alcohol on your general health, especially reproductive health. So I'm actually going to start when you come in. You just join me and keep your questions until the end of my presentation. So here's the deal. Alcohol can affect people differently. So how alcohol will affect me will not be how alcohol will affect you. Alcohol can also affect men and women differently. There are some people that have specific health risk factors that will put them in more danger when they consume alcohol. Generally, anytime you have the opportunity to drink alcohol, if you have to drink alcohol, please make sure you know the full knowledge of your health status. Make sure you know the type of alcohol you're consuming and what can happen, especially in our community. If you want to be a mother, if you're having problems of becoming pregnant, you actually do not need alcohol. If you are currently pregnant, you do not need alcohol. If you are already having sperm problems, you don't need alcohol. So if your partner has low sperm count, he doesn't need alcohol at all. If your partner is struggling with his body weight, if your partner is struggling with anxiety problems, weight issues, sexual performance issues, he doesn't need alcohol. Excessive alcohol can be a big risk factor, especially to men. It can lead to a lot of problems. It can lead to a lot of risk factors. It can lead to a lot of safety problems. So please make it a point of duty to limit your alcohol consumption. Possibly, if you can, please stop it completely. Now, I'm using an example in America. Statistically, adult men drink more than women in America. And I believe globally, men drink more than women globally. In America, about 59% of adults reported for the past 30 days that they used alcohol almost on a weekly basis. When you compare that to 47% of women, men are almost 2 times more likely to binge on alcohol. So when you binge on alcohol, it means you are consuming it beyond the limit that your body can actually perform. Now, there are some specific people that should not, so mark my word, should not consume alcohol. Number one, if you are younger than 21. So depending on your location, you should enforce this. The age you have to start consuming alcohol is above 21. If you are currently pregnant, or if you are believing to be pregnant, you see, some people might not know they are pregnant because they are not actively looking forward to becoming pregnant, but they can actually be pregnant. Some women can be pregnant up to second trimester without knowing they are pregnant. When you consume alcohol in your pregnancy or you're believing to be a mother, there are so many dangers that alcohol can lead to your forming baby, including what we call fetal alcohol syndrome, including brain damage and a couple of other developmental problems. If you are driving, you're in a social function, or you are planning to drive, or you're planning to participate in an activity, or you are participating in an activity that will require skills, or you need a lot of coordination, or you need to be very alert, you are not supposed to consume alcohol. So if you go for a function and you know fully well that you've consumed a lot of alcohol, please don't drive yourself. Let someone drive you home. Call Uber, call whichever services, or if you guys have some friends, please make sure that the person that will drive you guys home is someone that didn't drink alcohol. Now, if you're taking some prescription drugs and also some over-the-counter drugs, you are not supposed to take alcohol. There are some drugs that when you take and you drink alcohol, it will potentiate the toxicity in your body and it will lead to a lot of problems. If you're suffering from some medical problems, then definitely alcohol will not be your friend. Things like liver problems, stomach problems, kidney problems, diabetes, hypertension, you are not supposed to take alcohol completely. If you're recovering from alcoholism and you're unable to control your intake of alcohol, then you need help. You should get professional help. Now, when we talk about excessive drinking, excessive consumption of alcohol, this can be what we call binge drinking or heavy drinking or drinking when you're pregnant. Now, binge drinking is defined particularly in America, and we normally define it based on gender. So if you're a woman and you're taking 4 or more drinks during a particular occasion, so binge drinking is actually classified per occasion. So if you take 4 or more drinks during a single occasion, you have exceeded that particular level and is classified as binge drinking. For men, if you take more than 5 or more drinks in a single occasion, it's considered binge drinking. Heavy drinking is actually defined differently. For women, if you take 8 or more drinks per week, so binge drinking is classified per occasion, but heavy drinking is classified per week. So if you're a woman and you take more than 8 drinks in a week, you are considered a heavy drinker. If you're a man and you take more than 15 drinks per week, you are considered heavy drinker. You don't need it. Now, what are the health effects? What are the short-term health effects when you take alcohol? You see, when you take alcohol, you increase your risk of having some harmful health issues. Number 1, injuries. Most men that take alcohols are prone to having motor vehicle accidents, falling, drowning, having burns. Now, when you take alcohol too, you are prone to being violent. So you notice you will have tendency of committing crime, committing homicide, committing suicide, committing sexual assault, or intimate partner violence. So if you notice, most men that have inferiority complex, when they want to act or when they want to do something, they take alcohol to give them fake confidence. When you do this, you are putting yourself in danger. Some women and some men can also consume higher quantity of alcohol to the point of having what we call alcohol poisoning, which is an emergency, a medical emergency, because you have a lot of high level of alcohol in your blood. This can actually kill you. We need to get you to the hospital immediately. Now, when you consume alcohol in the immediate term, you have a tendency to be daring. You have a tendency to engage in risky behaviors, including unprotected sexual intercourse, or having multiple sexual partners, or having unintended pregnancy, or contracting sexually transmitted infections, including HIV. So when you take alcohol, it gives you a sense of false confidence, a sense of false courage. But once that alcohol is removed from your system, you see yourself back to the place you started, and you have a lot of regrets. Now, alcohol is directly and also indirectly related to pregnancy loss, especially miscarriage. Remember that miscarriage is the unintended loss of your pregnancy within the first 20 weeks. If you lose your pregnancy beyond 20 weeks, it's called stillbirth. So when you consume alcohol during your pregnancy, you are increasing the possibility of losing that pregnancy through miscarriage, stillbirth, or intrauterine death. If you consume alcohol during pregnancy, remember everything that goes into your body, by default, your baby will get it. So you might also be prone to having what we call fetal alcohol spectrum disorders. This is not good. This can damage you. This can damage your baby. So babies will be born and they will have this syndrome, and they will have what we call withdrawal syndrome. So if you see an alcoholic, if that alcoholic doesn't take alcohol within a particular time, the person will have withdrawal syndrome. So you can practically feel the symptoms and the presentation of this individual. Now, long-term basis, what can happen to your body when you consume alcohol on a long-term basis? Number one, you can directly develop high blood pressure when you take alcohol consistently on a long-term basis. Alcohol can also lead to development of heart diseases, including stroke, including heart attack. Alcohol can damage your liver because everything you put in your body, the best place to remove it, the toxic ones, is in the liver. So when you overwork the liver, you can develop liver disease. You can also have GI problems, digestive problems. But ultimately, and unfortunately, there are some cancers in the body which can develop following your use of alcohol on a long-term basis. So cancers like breast cancer, mouth cancer, throat cancer, esophageal cancer, your liver cancer, your colon cancer, and your rectal cancer. All these cancers can develop when you consume alcohol on a long-term basis. When you consume alcohol too, it can weaken your immune system. When your immune system is weakened, you can easily develop medical issues, disease conditions, infections. Alcohol can also affect your learning abilities, your memory. Some people can develop dementia. Some people can have poor performance, poor concentration, and some people can notice they have short-term memory loss when they indulge in excessive intake of alcohol. Alcohol can also affect your mental health, including depression and anxiety. So if you're taking alcohol on a regular basis, you're a candidate of depression or anxiety. Alcohol can also lead to social problems. You begin to have problems with your spouses. You begin to have problems with your mom, your dad, your siblings, your job. You begin to lose your job because you're not concentrating in job. You're not performing. So it can lead to job loss. It can lead to unemployment. Now, ultimately, if you end up having alcohol dependent syndrome, then if you don't take alcohol, you cannot function. So overall, you don't need alcohol for anything if you happen to find yourself in this category. Now, I understand some people say, but I can take a little, I can do this, I can do that. Now, until today, previously, we used to believe that there are some health benefits of alcohol, but I'm coming back to tell you today, the jury is back. There is no evidence-based true benefits of alcohol to the body. You can take it for whatever reasons. You can use it to feel good. You can take it occasionally, but there is no derivable gains, health gains from alcohol directly. There is none. If we have it, I will share with you guys. So please, by not drinking too much, you can reduce the risk of everything I've mentioned. Now, your too much is what you have to define depending on where you live. But I tell you this, if you are a consumer of alcohol, you know within your body when you're exceeding the limit. Most people drink socially. Most people drink based on peer pressure. Most people drink as status symbol, like when you hang out with your friends, especially men, when they're watching soccer, when they're hanging out, they drink a lot of alcohol to use it as a status symbol. We all did that. But right now, if you can listen to me, if you didn't make that mistake, you don't necessarily need all these on a long-term basis, okay? So alcohol can directly affect the male sexual function. So most men that take excessive alcohol can have testicular dysfunction. When you have testicular dysfunction, you might not be able to produce the sperm in the right quantity. Your testicles might not function properly. You might affect your libido. It can develop other problems. It might affect your hormone production. Remember, for you to be a man, to impregnate your woman, there are some level of hormones in your body that must work optimally. When you consume a lot of alcohol, it's going to disrupt all those pathways, so you might not be able to perform your civic duties. Engaging in alcohol excessively, like I've already mentioned, can put you in trouble. Alcohol can also lead to overeating, lack of sleep, And when you do this, you will not be motivated to exercise. So most men that drink alcohol, if you notice, they don't exercise, they don't have good quality life, their BMI is very high, they don't sleep, and over time you are developing a lot of medical problems down the lane. So you don't need this. I've already mentioned the connection between alcohol and injury and violence. Most partners that have domestic violence, intimate partner violence, if you probe further, you discover that there is alcohol consumption or alcoholism somewhere along the line. So please avoid alcohol as much as possible, especially males. Males are 3 times likely to die from suicide when they consume a lot of alcohol. Life can be challenging. If you don't have a good support system and you take to the bottles to take your sorrows away, it can drown you. It can lead you to suicide. It can lead you to homicide. It's not going to help you. So make conscious effort to avoid using alcohol as a temporal fix. If you already have the problems, I will advise you to get help from a medical practitioner. Okay? Right. So that's my presentation this evening. And the floor is going to be open so I can provide you feedbacks. I know it's not our top rated topics, but this is also important. In our community, we cover a whole lot of topics. Alcohol consumption can affect your health negatively. So please, the floor is open. Feel free to ask your questions. I actually got a couple of questions from my admin. So I'm going to start with the questions. So let me read them out. Okay, so the first question says, I've heard people say that alcohol is not bad for the body. That's called dead on arrival. Alcohol is bad on the body on so many levels. On so many levels. Any part of your body can receive directly and indirectly debilitating health impact of alcohol. So alcohol is bad for the body. The problem is not drinking too much. Is this true? Yes. So here's the deal. In America, like I've already given you guys the classification, right? Depending on your gender, if you're a man and you consume a particular quantity of what we call a drink, more than, then you might be classified as binging or drinking too much. But let's tell ourselves the truth. Sometimes you won't know where to draw the line. Okay, so what you can contain, and people handle alcohol differently. When I was in medical school, we actually drank alcohol in medical school, okay? So I'm not someone that pretend. We did all that. We tried all that, okay? So we go through a lot of stress in medical school, you know, book reading and all that, catching up with the academics. But when we have social functions, when we go out, when we have a birthday party or all that, most medical students and medical doctors tend to drink a lot. Now, people handle it differently. So there are some of our colleagues that will drink a whole lot and they will not be intoxicated. They will still wake up the following day and go for the exams and pass. Now, there are some of our colleagues that will just drink 1 glass or just the foam and they can be intoxicated. So people handle alcohol differently, but that's not the criteria. So you might be consuming alcohol on a long-term basis and you think you're good without knowing that your liver is dying in your stomach, without knowing that your kidneys are dying in stomach, without knowing that your stomach and a whole lot of your functions, your memory, you're developing a lot of things, but it might not manifest in the immediate. It might be 10 years down the lane. So in as much as your body can handle a lot of alcohol, it doesn't mean you should continue drinking it, especially people that drink regularly. If you drink occasionally, whenever you have occasion, you go and drink. Like using myself as an example, I had a reunion over the weekend. I had a wedding over the weekend. Did I drink alcohol? Yes, I did. Okay. Now, I'm not claiming to be like a saint and all that, but I know my limit. I know my limit. So I'm not gonna tell you outrightly, oh, don't drink alcohol. I'll be deceiving myself. But remember, there are some categories of people that should not drink alcohol completely. Now, no matter how you crave for alcohol in your pregnancy, I cannot allow you to drink alcohol in your pregnancy. No matter how you crave alcohol and you have liver failure, kidney failures, debilitating diabetes and hypertension, I can't tell you to drink alcohol because I won't be doing you justice. So the claim about alcohol being good for the body is what we call DOA. There is no merit. Alcohol is directly bad for your body, especially if you consume it regularly and excessively, or if you binge on it. Okay, so let's continue. I think I have another question. So I'm going to provide feedbacks to that. Is it true that what is over? Okay, I've already answered that. The second question is talking about what's too much. Okay, what kind of general health problems? I've already mentioned that. So any part of the body you can think of. So start from your head. Alcohol can affect your nervous system, your brain, your spinal cord, your coordination, your memories, your alertness, and everything. Then when you come down to your face, it can affect your eyes, it can affect your mouth, it can affect your throat. Then when you begin to go down to the stomach, to the esophagus, to your stomach, to your intestines, it can affect any organs in the body completely in the short term and on a long-term basis. So there is no way you can escape the effect of alcohol if you engage in it excessively. What about females and male fertility issues? The answer is yes. The same way alcohol can affect males, it can also affect females. So it can lead to hormone imbalance. So women that indulge in a lot of alcohol can actually flip the balance in their body. For men, if you engage in a lot of alcohol, suddenly you will discover that you have excessive estrogen in lieu of having more progesterone. Testosterone is the male form of dominant hormone, which makes you look like a man, which makes you perform like a man. When you have less testosterone, but more estrogen, you begin to behave like a woman. So men that have problems with their BMI, men that do not exercise, men that do not eat good food, men that have a lot of stressors in your body will start developing estrogen. They will start converting the testosterone to estrogen. And when they do that, they start having higher level of estrogen. And when you have higher level of estrogen, it can affect your fertility. Some men will begin to develop low libido, impotency, and visibly, some men will begin to develop what we call gynecomastia, male boobs. They are directly related to your alcohol consumption. On the flip side, when you consume a lot of alcohol as a woman, it can also affect your reproductive health by converting your estrogen more to testosterone. So there is no way you can escape it regarding alcohol. Okay? So those are the questions I have now. But if you have questions, feel free to ask your questions in real time. If today is the first day of attending my YouTube clinic, thank you so much. I come live every Tuesdays, 6 p.m. Eastern Time, US, 11 p.m. Nigerian. Please make sure you subscribe. We also have a special pack, a special community in YouTube in different categories where you can benefit. You can have one-on-one interaction with me. You can have exclusive content, and we can share a lot of ideas exclusively. If you are craving for that community, consider joining by clicking on the link. When you join, you select your option, then they can prompt me, then I can meet you halfway. Now, on Saturdays, I also come live, but I come live a little bit early. So Saturdays, 12 p.m. Eastern Time, 5 p.m. Nigerian time. So Tuesdays and Saturdays are regular YouTube clinic. We select topics of great importance and we talk about them. Okay? So if you still have questions, feel free to ask your questions. This coming Sunday, we have a big event in my community, gender selection and family balancing. So if the peace of your home is threatened because you have a lot of girls or you have a lot of boys and you want to have boys or you want to have girls, come, let's fellowship. This Sunday, let's learn about the right way to select a particular gender. It's possible to select a gender, but you have to do it the right way. Okay? Please keep asking your questions. Tosin, do you have any questions? You've been regular, you've been amazing. COO, please, I also want you to extend a hand of fellowship to this amazing member. She has attended all the clinics since we started. Please extend a hand of fellowship to her. I want her to be in the symposium free of charge. So Oluwatosin, send a mail to my COO, who is currently in attendance. She will shortlist you and you will attend free of charge. Our community is a small community, but we look out for each other. We watch each other's back. We care for each other. We love each other. So please, if you still have questions, feel free to ask your questions. This is an opportunity. This is an opportunity. Okay? If you are not consuming alcohol already, you are doing well. Don't plan to consume alcohol. Now, if you are planning to become pregnant, your pregnancy can come like a thief in the night. Some women will not know they are pregnant, and they will still continue to consume alcohol as if they are not pregnant. Alcohol consumption can affect you directly, can affect your baby. You do not want to carry your baby for 9 months, and because of your habits, your baby is going to have problems. It's selfishness. Now, some people can need medical help to help them with their alcoholism. Please make sure you register for help. If you need help, get help. There is nothing too big that God cannot help you to solve. Okay? So Tosin, contact Kene, and Kene will set you up. Do we still have any questions? If you have questions, please ask, and I'll provide you feedbacks. We still have about 4 minutes, so you can ask all your questions, even if it's not related to this topic. Use this opportunity, ask your questions, get a feedback, and we proceed to the next agenda. Okay? So I want to believe it's pretty clear. I'll make my transcript available, so be careful. If you have any kid below 21, no alcohol. If you're pregnant, no alcohol. If you have liver condition, no alcohol. Kidney condition, no alcohol. Diabetic, no alcohol. Hypertension, no alcohol. That's a fact. If you're on any antibiotics, no alcohol. Be very firm about it. Okay? All right. In the absence of any other question, thank you so much for coming. I'll see you guys again on Saturday. We'll select another topic. Remember to keep preaching the good news. PPP. Pray, play, practice. It works. If you're believing God to be a mother, a father, soon, continue praying, continue playing. Playing means 48-hourly love making. Practicing means putting everything we've been teaching you into practice. If you can diligently adopt PPP method, before you know it, you're going to become a mother, you're going to become a father. Nothing can stop you from the love of God. Thank you for coming. Can I thank you so much? Tosin, thank you. I'll see you guys again on when? Saturday. And if you're attending the gender selection, I will also see you on Sunday. Good luck and enjoy the rest of your evening. Bye-bye for now.